Comparing Oklahoma City home health care to Tulsa options. Courtesy of EMSCO Solutions, Information Technology Guide for Oklahoma City Home Health Care Organizations. Medicare defines home health care as a broad range of healthcare services provided in a home setting following an injury or illness. According to Medicare's website, home health care is usually less costly, more convenient, and often as effective as care one would receive in a hospital or skilled nursing facility. Recent research from IBIS World sees home health care as a $73 billion industry that employs over 1.3 million people in over 300,000 businesses. Given that those stats work out to just over 4 employees per business, it's no surprise that no companies have dominant market share nationally. But what about the Oklahoma City home health care market? And how does it compare to options an hour and a half away in Tulsa? While there are a number of ways to search for available options, for this article, I focused on home health care services agencies that are listed in the Medicare.gov Home Health Compare directory. Home health care in Oklahoma City. When searching for home health care agencies in Oklahoma City, 102 results came back. The initial findings in the table are in alphabetical order and show whether each agency provides one or more of 6 core services: nursing care, physical therapy, occupational therapy, speech therapy, medical social services, and home health aid. To uncover the list of agencies that provide the broadest range of services covering all 6 of these categories, applying the filter reduced the 102 results down to 87 results. So the overwhelming majority of home health care agencies in Oklahoma City that are registered with Medicare, about 85%, cover all 6 categories of services. In other words, it's difficult to compete without covering this broad range of home health care services. When looking up NAICS code 621610 or home health care services, there are at least 5 large home health care agencies with locations in the greater Oklahoma City area: Carter Healthcare, Healthback Home Health, Healthcare Innovations Private Services or HCIPS and Professional Home Hospice, Lifeline Home Health and Hospice, and Ross Healthcare. Is home health care in Tulsa underserved? Now, running the same home health compare search on the Medicare.gov for Tulsa, you'll find 62 home health agencies registered with Medicare as compared to 102 agencies in Oklahoma City. The Oklahoma City metro area has a population of 1.2 million as compared to a population of 900,000 in the Tulsa metro area, 2010 census. So with about 25% fewer people, one would expect fewer Medicare-registered home health care agencies. Now, it's not quite statistically perfect, as we're looking at 2010 census data and 2015 Medicare directory data. However, at least on the back of the napkin calculation, there is one Medicare-registered agency in Oklahoma City for every roughly 12,000 people. That's 1,252,987 divided by 102. Moreover, in the Tulsa metro area, there is one Medicare-registered agency for approximately every 15,000 people. That's 937,478 divided by 62. So, are there too few agencies in the Tulsa metro area? Alternatively, are there too many home health care agencies in the Oklahoma City metro area? And again, to get a feel for some of the key providers in the Tulsa home health care market, we ran a search on NAICS code 621610 with locations in the greater Tulsa area and found Carter Healthcare, Community Home Health, Hospice of Green Country, Millennium Home Healthcare, Specialized Home Nursing, VNA of Tulsa. Comparing the list of some of the larger providers in Oklahoma City to some of the larger providers in Tulsa, Carter Healthcare is the only home healthcare agency appearing in both searches. What do you think are some of the big differences between how home healthcare is provided in Oklahoma City compared to Tulsa? Share your take in the comments below. And if you lead or manage home healthcare agency in Oklahoma City or Tulsa and are looking to find new growth strategies, maintain HIPAA compliance, and better utilize technology, be sure to download your free copy of the IT Guide for Oklahoma City Home Healthcare Organizations. You can download a copy of this guide while it's still available at okchomehealthitguide.com. Thanks so much for stopping by and tuning in today to learn all about comparing Oklahoma City home healthcare to Tulsa options.